Hey everyone, and welcome to your ABSITE Daily Dose. I'm so glad you're here. Today, we're going to crack the code on a super important topic, necrotizing fasciitis. We're going to make it easy and memorable, so you'll be all set for test day. Let's do this together. Okay, let's dive right in with our first case. You know, that very first move you make when you suspect this scary infection? Well, it's the most important one. Getting this right changes everything. All right, here's our first puzzle. We've got a 58-year-old man with diabetes. His leg is swollen and really painful, but it only looks a little bit red. When you touch it, though, he screams. That's our classic pain out of proportion. So, what is the next best step? Is it A, get a CT scan? B, calculate the LRNEC score? C, go for immediate surgical exploration? Or D, start IV vancomycin and Zosyn? Take a few seconds to think it over.
And the correct answer is C, immediate surgical exploration. You know that phrase, pain out of proportion, is the magic key. When you hear that, especially in a septic patient, you don't need any other tests. The operating room is your best friend. It's where you diagnose and treat. Waiting for a CT scan is just too dangerous. Remember, time is fascia. And yeah, antibiotics are super important, but getting that source control with surgery is always priority number one.
Okay, here's an exam super tip for you, and it's a big one. When you're thinking it might be necrotizing fasciitis, when in doubt, cut it out. Seriously, the OR is the best test you have. Don't waste a single minute.
Awesome job on that first one. Now, let's head over to the pharmacy. We need to figure out which medicines are going to be our super helpers in this fight. Picking the right antibiotic cocktail is a huge piece of the puzzle.
So, our patient's in the OR, you're seeing some crepitus, that crackly feeling under the skin, and that classic dishwater pus. Now you've got to choose the right antibiotics, and fast. What's the go-to regimen? Is it A, vancomycin, Zosyn, and clindamycin, B, vancomycin and meropenem, C, linezolid and meropenem, or D, daptomycin and cefepima? What do you think?
You got it. The answer is A, vancomycin, Zosyn, and clindamycin. This is the gold standard, the triple therapy you need to know. But the secret ingredient, the one you absolutely must not forget, is clindamycin. It's special because it's a protein synthesis inhibitor. That's just a fancy way of saying it stops the bacteria from making the horrible toxins that make the patient so incredibly sick.
High yield alert. Seriously, burn this into your brain. Never forget clindamycin. It's the hero drug that literally shuts down the bacteria's toxin factory. It's a game changer.
You guys are on a roll. Now let's look at a couple of special cases. We're going to cover two famous syndromes you absolutely have to know for your exam. They have their own special rules.
Okay, check this out. A patient shows up with spontaneous gas gangrene in their thigh, and the culture comes back for Clostridium septicum. After you've done the surgery, what is the one mandatory screening test you have to order? Is it A, an echocardiogram, B, a colonoscopy, or C, a bone marrow biopsy?
That's right, it's B, colonoscopy. This is such a critical point. See, Clostridium septicum is a sneaky little bug. It doesn't need a cut or injury to cause an infection. It can actually crawl out from the gut. And there's a really strong connection between this specific bacteria and a hidden colon cancer, especially in the cecum.
And here's a fun little trick to help you remember that on test day. Exam super tip. Think C septicum. Kind of sounds like cecum, which can help you remember to check the cecum. So C septicum means you always check the colon.
All right, next up is a total classic, a Fournier's gangrene question. You're in the middle of a debridement and you notice the testicles look perfectly healthy. So how do you manage them? Do you A, perform a bilateral orchiectomy, B, try to close the skin over them, or C, place them in subcutaneous thigh pouches?
The answer is C. You place them in subcutaneous thigh pouches. And the reason for this is so cool. The testicles have their own special blood supply that comes straight from the aorta, so it's totally separate from all the infected tissue around it. That's why they're usually spared. Our job is to protect them from drying out by tucking them away safely in these little pouches in the thigh until the patient's ready for reconstruction later on.
So here's your high-yield alert for this one. Just remember, the testicles have their own VIP blood supply. They're special, so we save them in a cozy thigh pouch to keep them safe.
Whew, the first surgery is done, but our job isn't over yet, not by a long shot. Let's talk about the super critical post-operative plan. What we do next is just as important as that first operation.
So, after that initial debridement, what's the game plan? When does the patient go back to the OR? Do we wait and see if their fever continues? Do we wait for their white blood cell count to go up? Or is it B, a scheduled re-exploration within 24 hours? What's the right move?
You got it. The answer is B. A scheduled return to the OR within 24 hours is mandatory. It's not an option. You know, one surgery is almost never enough to get rid of this kind of infection. So we have to plan a second look to make sure the infection has stopped spreading. The key is to be proactive. We don't wait for the patient to get sicker.
And that brings us to our last exam super tip. Remember this core principle. One cut is never enough. You always have to plan a second look date with the OR. Okay, team, you did an amazing job. Let's quickly review the top 5 cutest, most high-yield pearls from today's session. Let's lock these in so you'll never forget them.
Here we go. 1. If you see pain out of proportion, you go to the OR now. 2. Always add clindamycin to your antibiotic mix to shut down that toxin factory. 3. C. septicum gangrene means you must do a colonoscopy. 4. Healthy testicles in Fournier's get saved in cozy thigh pouches. And 5. Always plan a second look surgery within 24 hours. You got this.
And that's our daily dose. If you want more friendly exam stories with little surgeons like me, don't forget to like and subscribe to ABSITE_Daily Dose. You're doing great work, keep it up, and I'll see you in the next one. Bye.